I mean, it was 1 hour being in the lowest of low, like, oh my gosh, what are we doing? To there's hope again. And that's what CHF gave us. Spring break of this year, our oldest son's team did a baseball tournament in Arizona. And before this spring break trip, we had been going to the doctor multiple times trying to figure out why we couldn't get over whatever it was. And we knew this Arizona trip was coming up. So the doctor had told us, hey, once we get to Arizona, it will clear up because it's different allergies there. Oklahoma is so heavy allergy centric that he just can't catch up. It's all raw and it just keeps happening with nosebleeds. So we're on our way to Arizona and he gets a nosebleed. And Dylan and I just will never forget it. We looked at each other and we're like, it wasn't just allergies, I just didn't know what.
We finally took him to the doctor and they said, hey, you need to go to an ENT and figure this whole thing out. We go to the ENT and during that time, they noticed something up there. And they said it doesn't present itself as a polyp. And I told Emily after we left that doctor's appointment that they think something's seriously wrong. And so at that point, it turned into a CT scan, an MRI, and that's when they diagnosed him with a stage 4 benign nasophalangeal angiofibroma. Once that diagnosis happened, I mean, we were kind of spinning. We didn't really know what to do. We didn't really know how to proceed because it's an extremely rare vascular tumor. There are less than 50 cases of it worldwide each year.
I teach second grade. Dylan does sports. Like, we know our specialties. We're good at our jobs. We are not medical. Like, we've been through a lot with our kids, but I don't know what all those big words are. I don't know what we're looking at. I don't know what stage 4 means. You know, it's like, I know it's not good, but it's scary. Our treatment options were Texas or Tennessee. It was all out of state. It wasn't anywhere close to home or really even drivable for that matter. In the midst of figuring out what his diagnosis was and kind of what that looked like and what our options were, we were at baseball practice, of course, and I was talking to one of my mom friends who happens to be a nurse. And I'm like, okay, this is the situation. If you were in our shoes, what would you do? And she said, what are your options? And so I told her our options and she said, I don't like your options. And I said, what? And she's like, I just think there's something else. And I'm like, okay. So we get in the car, Dylan and I, and we're driving and I'm like, I don't know what to do. I'm like, now we've got these choices, you know, we're trying to figure out what the best path is. We sat there in silence for a second and I said, I think we need to post on Facebook. Between the two of us, we have a lot of people in our lives. And I'm like, we need to post that we don't know what to do. And if nothing else, maybe they could just pray for our family for guidance. So I posted on our drive home and I just said, here's our situation. I don't know how else to say it. We don't know what to do. And I kid you not, before we even got home, Jeremiah had texted us saying, hey, I know a guy. And I'm like, what? And we're looking at each other like, you've got to be kidding me. And the wild thing is, our oldest son had medical issues when he was a little boy. And it wasn't genetic, it was just a freak thing. Jeremiah was interning with CHS at the time, and he was our connection. And so now fast forward 12 years, we live in the same community. His kids go to the school I teach at. So for him to reach out and say, hey, I know a guy, whatever, he ended up connecting us to Dr. Ramji. We're on our back patio in, 30 minutes probably? Talking with who's gonna be our heroic surgeon, you know, in just a few days, but we didn't know that at the time, telling us like, hey, I know exactly what this is. I actually have been trained on this, easing all of our fears. I mean, it was 1 hour being in the lowest of low, like, oh my gosh, what are we doing? To there's hope again. And that's what CHF gave us.
Most people have a hard time getting in with their physician, their primary care physician or their dentist, but we had a cell phone number and we were talking to him 30 minutes after a Facebook post. So that's what CHF did for us in no time. He was able to get 6 incredibly skilled and talented surgeons from the state of Oklahoma to do a surgery 11 days after that phone call. It was slated for 12 hours. They got it done in 7 hours. Dr. Dunn, Dr. El Rossi, and Dr. Ramji walked in, and in true typical Buckingham fashion, they told us, we hit a grand slam with this. And it was the coolest thing ever. You know, those guys we owe everything to. They've been godsends to us. I realize how fortunate we are because it really could have been a lot worse. He was in the PICU for 4 days. He got out of the hospital 5 days after the surgery. We were supposed to be there for 6 to 8 weeks. I mean, he's such a strong kid. And for him to do this, just as if it was second nature, I mean, he's my hero.